Good evening. Thank you for being here this evening. I'm Lubbock Mayor Dan Pope. I want to introduce some guests of ours from the West. We're joined tonight by the Mayor of Levelland, Barbara Penner, by County Judge Baldridge, and by City Manager Eric Raheno. Hope I got that right, Eric. Thank you guys for coming over. With no further ado, I'd like to introduce Catherine Wells, the Director of the Lubbock Health Department. Ms. Wells.
Thank you all for gathering here so quickly this evening. This is something that we've been anticipating, and this evening, probably around 5:30 or so, I received notification from our local response laboratory that we have 2 locally confirmed cases of coronavirus. One of these cases is a resident of Lubbock County, and the other case is a resident of HOCKLEY County. These are both travel-related cases, so this is not community transmission, and these are unrelated cases. They just both happen to be tested within the last day or so. The health department staff is currently working to identify any recent contacts, and we will begin monitoring those contacts. So that means we're going to ask any contacts of these individuals to refrain from going out in public, practice that social distancing, and then also asking them to monitor themselves for fever or any signs or symptoms of coronavirus. And if we see any of those signs or symptoms, we would quickly get those individuals tested to see if they are also positive. We want to take this time to remind everyone to follow the proper hygiene recommendations that we've been talking about for the last few weeks. Also, if you're sick, please stay at home. It's important that we don't spread this to any of our vulnerable populations. And then we also want people to practice social distancing that we talked about in yesterday's press conference, and have been putting a lot of that information out on social media today. And I'm going to turn it over to Dr. Cook real fast. Thank you.
Thank you, Catherine. I just want to reiterate that it's here, and we're a little bit nervous about it, but let me reassure you that our healthcare system is ready for this. I have been in numerous meetings at the Health Sciences Center. I know that UMC has been prepared. I know that Covenant is ready to go, and I know that the Heart Hospital has been in meetings on how to handle this, and we're all in preparation on how this might occur or spread if it does spread. And so be rest assured that we are ready to go. We are ready to handle this situation. Let me reiterate what Catherine said. Practice this social distancing. I know that that's hard to do. You're bored. You may be sitting around, especially if you've been asked to self-monitor. But that doesn't mean it's right to get out into the public, okay? We must stay at home. We don't want this to spread if you've been asked to self-monitor. I know that the other systems are also prepared. And make sure we also continue to do hand hygiene. And if you're ill, stay home. It doesn't matter if you think you have the COVID virus. If it's just a common cold or the flu, please stay home. Please stay home. Let's practice this social distancing. We are strong West Texas people. We will weather this storm. Absolutely, I have complete faith that we will weather this storm. We're strong West Texas people. And if you heard Ted Mitchell tonight on the Fox News, he said we must choose to be sacrificial and not choose to be selfish. Please check on your neighbors. It's our job to make sure we take care of each other. That's all I have.
Thank you, Dr. Cook. That's all we're prepared to offer tonight. As you might imagine, this is very fresh for us. The investigations, as Catherine mentioned, are underway and will continue. I'm certain we'll have more information to share with you at some point in the future. We'll take a few questions. The city manager is here. Just one announcement too. We will not be having coffee with the mayor tomorrow morning. We're scheduled to have that at 7:30 tomorrow morning at Amigos. We feel like it's appropriate that we cancel that. So I thought since the media was here, this is the best way to get that out. We'll be releasing that on social channels too. I'm joined by the city manager, along with Dr. Cook and Ms. Wells. We'll take a few questions.
So these people were sent home from the hospital?
Dr. Cook or Catherine?
Yeah.
Go ahead.
Individuals were both individuals that traveled. They reported symptoms to the health department, and we were able to facilitate that testing. And that's all that we can provide at this time.
So they didn't actually go into a hospital, they just called in their symptoms?
Yeah, we're working on the investigation right now. So I don't have all of the details.
But can you say, are they at home?
I have staff working on the details and working on making all of the proper notifications. And
We're still researching the details, like Catherine said. They were never hospitalized. They met the criteria to be monitored, and so we asked them to stay at home and self-monitor. And so they met the criteria also to be tested. So we tested them, and that's how they came up.
To me, that's kind of reassuring.
It is very reassuring. These are travel related. It's not community acquired. That's great for us, right? Which means we need to stay in and social distancing, right? So that's good for us. That's great news for us.
But do we know if these folks have gone out and have been socializing or exposed others?
We're still, that's part of the research going in and visited with them. They were asked to stay at home, so that's our goal.
You know, one of the risks of having a press conference 2 hours after we found out about this is we can't answer a lot of questions. We've promised that we would be open and transparent with you. We'll have a number of those answers relatively soon, and we will provide those. But we're telling you what we know right now, and we're taking a lot of caution to make sure that we get it right before we share that information. As you might imagine, we think that's the most prudent way to go about this.
Excellent. I might add a little bit more to the process. Obviously, this was a potential. It was a potential several weeks ago. So our protocol, and unfortunately today's the first day we've had to use it, the protocol was in place as well. We reported today on our 4 o'clock update, posted just before 5, that there were 0 cases. And that was correct at that time. At approximately 5:25 today is when the lab was able to confirm the 2 additional. So they had continued their work going through the test. They made the notification that comes into the public health department, and that set in play the protocol that has resulted in all of us being here tonight. Our goal, and it worked today, I think we beat it by about 11 minutes if I did it right. Our goal is to be in front of y'all within 2 hours of having a positive test. A lot of things have to happen to make that happen. Have to confirm. So what we've told you today is all confirmed information. What we're not able to speak to is just what we do not have confirmed yet. It will come. It will. Confirm information, make contact notices back through various specific, points of contact, and then get here tonight. So, ma'am?
Now, how long did it take that test to turn around for results?
I don't know how long. It had to run after the first set.
yeah, I believe it was within 24 hours. It might have been 36, but no more than that.
And it's tested here?
Yes, it was tested here, and I was notified, I was notified this evening as I was leaving the Emergency Operations Center.
For public's sake, can you go ahead and give a phone number that they could call if they are feeling any symptoms, or repeat the website?
Okay. We have added additional staff to handle the numerous number of calls coming to the health department, and that phone number is 806-775-2933. And if they press option 1, they will be directed to staff to answer those questions, and then providers should press 2. And then they will be directed for testing information.
Now that there are confirmed cases, does this change the 200-person gathering limit? And how was the limit of 200 people chosen?
I think we've clearly defined how we made the 200-person decision yesterday. And if we want to revisit that, we can do that after the conference one-on-one. We will consider We'll continue to make decisions based upon the facts and the best information we have. And I would think that we very well could reconsider the 200 person gathering up front with you. And as the council feels like we need to make changes, we will do those, and we'll make everyone aware of that at that time.
Mayor, can you just talk about one more time,
Sure.
We've been encouraging, and I know
Yeah.
you guys have been pushing the message of social isolation, but
Yeah, so there's several things. First and foremost, we expected this to happen. We were not looking forward to this, but we expected it to happen. We've got protocols in place. In fact, I was leaving to go over to the emergency meeting that Lubbock ISD had at 5:30 tonight. And we had just finished talking to a number of our key constituents because we're going to make some changes at City Hall to limit person-to-person contact. And as I had my backpack over my shoulder, and Jarrett said, "Hey, sit tight, we just got 2 positives." We were ready for that, and that's what we're talking to you about right now. We want people to take seriously the threat. If you're working from home, work from home. Your social distancing, take that seriously. We also, though, want you to make sure that you look in on your family members, on your elderly neighbors, and you can do that over the phone. You can do that in keeping a social distance. But the last thing we want is hysteria, okay? Let's go about life. We're thankful that these are both travel cases. We'll all be more assured when we know more about it. But we will evaluate everything we've put in place as we did yesterday, as we did today, as we will again tonight and tomorrow morning. And as we change things, we'll let you guys connect us to all our citizens. And that, again, the safety of our citizens remains job one for us. And I know on behalf of the council, I can share that with you. We've gone as far, just so you're aware, we've gone as far at a council level, even before this case today, or these cases today, we've gone as far as to take some precautions ourselves to separate us, much like KCBD has done with Karen and Abner on their newscast. We think those things make sense, and I think you should expect our leadership to be that thoughtful as we plan.
Where do they travel from?
We don't know that. I mean, we know their travel cases. When we have that information, we'll share that with you.
I have a question, Dr. Cook.
Yes, ma'am.
I have read that 8 out of 10 cases for coronavirus are mild.
Mm-hmm.
And it kind of plays into that by you saying these 2 cases have been sent home to recover. But I haven't heard anybody say that locally. Is that the case?
It is true. About 80% are going to do very, very well. It's those individuals that, with increasing age, over 65, and then those individuals that have comorbid conditions, what we call comorbid conditions, so heart disease, lung disease, uncontrolled diabetes, hypertension, and then the other special population we're looking at is pregnancy. So those all may have a worse outcome.
Pregnancy is an issue?
It is.
For the mother or not the fetus?
Mother. From the studies that we've seen or read about from China, the delivery of the child, it doesn't cross the placenta, and so the children are usually born very healthy, and it may be that we might need to separate, if the mother is ill, that we separate the baby to protect the baby. So that's not written in stone, and I'm probably speaking a little out of context, but that's something to consider.
Are y'all able to share ages or age ranges?
Not at this time.
Now that there's a case locally, will the travel requirements to get tested change?
You know, they're both travel related, and so the system that we have now in place is from the CDC. You know, the biggest problem is we just don't have enough test kits nationwide, not only just in Texas, in West Texas, that is a problem. And so we have to test the the individual who is probably going to be the most positive by evaluation, by questioning and travel history and contact. And so we just have to be careful with what we have, because we just don't have enough test kits.
Dr. Cook, would you mind speaking? You made a comment for us Monday.
Uh-huh.
The actual testing versus the treatment are two separate issues.
True. So worst case scenario is if we don't have a test kit that says you're positive, if you present with high fever and these muscle aches and pains and sore throats and those sorts of things, just like it presents very much like the flu. And so if you're ill and you've been around a known contact and we don't have a test kit, worst case scenario, we don't have a test kit, we're still going to treat you the same way, which means you're going to go home and go to bed, stay away from other people, give you what we call supportive care. So take things that make you feel better, Gatorade and Tylenol and Motrin and those sorts of things that make you feel better. That's the only treatment we have at this time. We have no drugs to treat this medicine. The medicine that we have to treat flu is like Tamiflu. Some of those drugs, those aren't working or on this particular virus. And so now they're rapidly pushing out studies. I think Dr. Fauci at the, you've seen him on the national news, said they gave their first doses of that new test drug today. At 3 different levels, 250, 500, and 1,000, I think, were the doses that they gave. And so, but it's an experimental drug, and it's not going to be here this year. It's not going to be here this year. I'm personally not counting on it being available for me to use for somebody that I'm treating with COVID. And so, and it's just supportive care.
Dr. Cook, how many test kits does Lubbock or Lubbock County have? How many do we actually have?
We've got enough to test the individuals that we're really concerned about. We do not have enough to test everybody that wants one.
Well, how much is enough?
I'd have to go check, but I don't have that number. Yes, sir.
Do we know what the false negative rate is for the test kits that are being used? And I think I heard the answer to this, but is the protocol in that instance going to be the same even if it was a positive?
I don't care what the test says. If you have the symptoms, I'm going to treat you as if you have the symptoms. We may easily outrun the nation's number of test kits. There may be more cases than we have test kits, and I'm going to treat you the same. Currently, if you're tested at our laboratory that we have locally that's doing the test, that's what we call a presumptive positive test. We treat it as a positive, but then it is also sent to Atlanta to confirm that positive test. So there's a double backup or a backup there. So it's a presumptive positive and then confirmed in Atlanta.
You mentioned the incubation period of 2 to 14 days
Mm-hmm.
before it hits. After somebody's recovering, is there a similar period afterwards where you can still be contagious even if you're recovering?
Perhaps, I haven't seen those numbers, but even if you're feeling better, it looks like most people are start to feel ill around day 5 or so. And then I know that people are going to still probably feel ill for a week, 10 days, not feel very good at all. And then after that, you're going to start feeling better. Like I said last time, you may be shedding virus in the stool or something like that, but we don't know if those virus particles are infective. So chances are, this is what I would do. If I'm sick, I'm not telling my wife to come in to the bedroom. She's sleeping in the other room. Okay, and I'm just she can leave the food at the bedroom door, and I'll try to get over there and get it. So chicken noodle soup and Gatorade. So.
All right, one more question, please. Yes.
So really, the number of test kits is kind of insignificant, because if they're really bad, you're gonna treat them the way you would treat them if they needed help, and if they're not as bad, you're gonna send them home and they're gonna recover like they would with the flu.
Yes, absolutely. At least initially, we're not. Even if you test positive and you're not having worrisome signs like confusion, lethargy, unresponsiveness, chest pain, chest wall pain like you have pneumonia, shortness of breath, turning blue, purple around the lips and fingers, really rapid heartbeat and rapid breathing, you just need to go home.
What was the fever level again?
High fevers, 103. High fevers.
Okay, thank you so much for being here tonight. We promise as we have more information, we'll be in touch.